Schubert, and I'm here to talk about the legalization of medical marijuana. And here are my audience members: my mom, Gigi, Nina, and Betsy, Grandma, and Ferdy. Every day you wake up, there's someone suffering from severe pain that could be relieved by the use of medical marijuana. The American Medical Association has proven that there is advantages to the use of medical marijuana and it should be researched. I'm here today to persuade you to support the use of medical marijuana, but not the full legalization of marijuana. Now I'm going to mention a few diseases that their effects could be reduced by the use of medical marijuana. First, I have cancer, and HIV. The use of medical marijuana could help reduce the nausea that you have, and that could also increase the appetite, because with cancer patients and HIV patients, their appetite tends to be decreased. Glaucoma, marijuana decreases the pressure in your eye, which is the cause of the disease. It also acts as an anti-inflammatory. These three right here are muscle disorders, and marijuana decreases muscle spasms. It acts as anti-inflammatory, like I also said. It can also reduce in epilepsy the number of seizures people have. Other ones mentioned are people that suffer from chronic pain disorders. Again, marijuana acts as an anti-inflammatory. With migraines, another one, it can reduce the severity and also the frequency of the number of times you have migraines. Arthritis, again, acts as anti-inflammatory, reduces the pain. Asthma, which was a shocker, you would think with people that have asthma that smoking would induce the effects, but actually marijuana decreases the effects because it's an anti-inflammatory, which opens up the airways. One disorder I found interesting was a digestive disorder, which is called Crohn's disease. Again, many people have appetite issues, and marijuana tends to affect that. Now I'm going to talk about the effects that many people perceive as having problems with marijuana. There's no evidence linking marijuana to being addictive. Many people believe that if you smoke a lot, you're going to be addicted to it. It's actually the least addictive drug out of the two legal drugs we have in this country, which is cigarettes and alcohol. Marijuana also doesn't have a link to memory loss. Many people believe if you smoke a lot, you tend to have memory loss, short and long. There's also no advantage to motivation. Many people believe if you're a pothead, then you won't have any motivation in life. There's no evidence supporting that you have motivation problems. Also, there's no evidence that there's reproductive problems with marijuana. Again, like I said, virtually all doctors believe that marijuana is to be the least addictive drug out there. There's many supporters for the legalization of medical marijuana. Certain states such as Colorado, California, Michigan, and Oregon all support the use of medical marijuana. A few associations, the American Medical Association supports it to an extent. There's cannabis news out there. Many people support the use of medical marijuana. But again, like I said, I don't support the full legalization of marijuana, and these are the reasons why. Marijuana is considered as a gateway drug, and to people that don't know gateway drugs, it's defined as if you smoke marijuana, then you're going to be addicted to other drugs. You're going to be introduced to like cocaine and heroin. The short-term effects, again, you can have motivation problems, like you can be extremely lazy, you can be jobless. Numerous people that smoke tend to be extremely lazy, and they have possibly break up families. It has if you had legalized marijuana, it could increase in motor vehicle accidents due to the visual problems you tend to have when you're smoking marijuana. If you had legalized marijuana, then you would have an increase in drug dealers and possibly more crime. So not making it totally legalized can keep crime lower and decrease drug dealers out down the street. Imagine the world with medical marijuana. I'm going to list a few things. You would have lower insurance payouts because medical marijuana could replace some of those drugs that would be prescribed that marijuana could replace. Prescriptions would be reduced. According to Bill Zimmerman, in some patients, they would respond better to treatments such as radiation and chemotherapy, and HIV suppression drugs reduce the harsh symptoms brought about by other medical treatments. Also, it would increase productivity at work, and it would decrease absenteeism. According to Francis Young's own administrative law, it's the DEA's own administrative law judge, marijuana in its natural form is one of the safest therapeutic active known substances to man. So I encourage everyone to support medical marijuana and participate, and so that all others can suffer less and help fellow man to live their potential and fulfill their dreams of living in a healthy position. Now I'm going to talk about my personal experience with marijuana and the college life at my school. I will admit I have many friends that enjoy smoking marijuana, and they are in 100% support of legalizing marijuana. I personally don't feel that it should be totally legalized, like I mentioned in my speech. I think people would take full advantage of it, and I think it would ruin lives. But my friends believe that if alcohol is legal, then marijuana should be legal, because alcohol apparently alcohol is worse for you than medical marijuana, or marijuana in general. My friends believe that not being able to smoke something because people believe it's bad for you, even though cigarettes are legal, kind of defeats the purpose. People tend to, it makes no sense. I'd like to now thank my audience again, my mom, which is right here, Nina, Grandma, Gigi, and Ferdy right here. Again, I want to thank my audience, and I want to thank you for watching my speech. Thank you.
Cool. Good job, Eric.